One more example. Central.
Central, we've got a very small lateral there.
That's a peg lateral, and that is a not too uncommon variation. Some wacky things happen at the maxillary lateral incisors, and having malformed or peg lateral incisors does happen. But now we go distal to that peg lateral, and
where's the canine? Where
is the canine? There you go. Very good. Now we're going into the x-ray again. And how do we report that canine?
It's there, but it's definitely impacted.
Definitely impacted. Now let's go back to the mouth. Very important step. Is there enough space for number 6 to erupt?
I don't think there is enough space for number 6 to
So
erupt.
that is called severe crowding. Okay? Important to recognize an impacted tooth, and number 6 is impacted. It's also important to recognize severe crowding, lack of space. Not all impacted canines are due to lack of space, but here we can make that association based on the evidence in front of us. Finally, now this could be a little bit challenging for dental students especially, because dental students in their clinical training seem to see more adult patients than younger patients. This is a younger patient. How do I know that? Not only because he looks young, his face looks young, but when I'm mapping out the teeth, I notice central lateral question.
Where's the canine?
First premolar, what's that?
That's a second primary molar.
You've never seen a second premolar look quite like that. That's a primary second molar. And 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 here's a primary canine. So this is a much younger patient than we've seen before, but something that is required for general dentists to be comfortable treating patients at all stages of the life cycle. So you may notice that primary canine. You may notice that tooth number 22, the mandibular left permanent canine, is just a little white dot that's right there on that photo. And then you look at 27, it's barely erupted. And then you look at number 11, and it's not fully erupted. So, and then you look at this, where is the canine? Do you see it?
It's in the x-ray.
It's on the x-ray. Is there enough space for number 6 to erupt?
I think there's adequate space here.
So here there is adequate space. So it's not like the previous examples. It's not impacted canine due to lack of space. There's plenty of space. So we cannot say that there's severe crowding in this patient because there's plenty of space for the canine. And on top of it, when we consider the stage of development and the status of the other canines, there's very little evidence to say that there's a problem with number 6 at all. This is a snapshot of normal development. And maybe because the focus in training is on all the abnormal conditions, all the pathological conditions, that it's sometimes challenging for dental students especially to recognize the range of normal. This is within the range of normal.